Morning again. Hi, everyone. I am Irene Quezon. I am the RIGA for Asia Pacific Regional Emergency GBV advisor, advisor on behalf of the GBViE, Asia Pacific GBViE working group. We want to welcome you to our risk mitigation series. This is part 2 of the 3-part risk mitigation series for 2024. So for today, we'll be talking about the AAAQ framework and consultation with women and girls. When we talk about AAAQ framework in risk mitigation, we're talking about availability, accessibility, acceptability, and quality. So this webinar is also co-hosted with our colleagues from UNICEF, IOM, UNFPA, and we're also happy to have us joined by the Interagency PSEA Network for Asia Pacific. So let me just read through our... The screen is not always the best. Okay. Let me go through the outline. So this is our outline for today. If you feel free to introduce yourself, your name, your position, where you're coming from, what sector, which country, and if this is the first time you're joining us in our small community here for Asia Pacific, welcome. I'm seeing a lot of familiar names. I'm so excited actually about this webinar too. So our webinar will cover first, we will have a recap from our first webinar by Sunita, and then we'll go through the AAAQ framework, and then a case study coming from Micronesia. And then the second part of the webinar will be on consultation with women and girls. And this time it will be a case study on Bangladesh. We've also included how this framework relates to our work in PSEA. So Pam will come in as well on that discussion. And then we'll end it up with a Q&A and hopefully a discussion in this space, and then wrap it up. Before I move you to Sunita, let me just read out and introduce who we are. Okay, so we are the Asia Pacific Gender-Based Violence and Emergency Working Group. We are the interagency team created to enhance capacity building, and I cannot see my screen, and technical expertise on GBV and emergency in Asia Pacific region. We are chaired by UNFPA and co-chaired by the GBVAOR. Our members include the regional level actors focused on GBV risk mitigation and response in emergency, including preparedness and recovery. The working group facilitates quarterly meetings, webinars such as this one, technical support, advocacy briefs, experience sharing, etc. So if you need more information around it or would want to meet our experts, we have a lot of experts for this morning with you, for you. So let us know. My email is on your screen. So thank you, and I'll move you over to Sunita. I'll allow all our colleagues, our experts, to introduce themselves for this morning. Thank you again. Over to you, Sunita. So let me just figure out. There you go.
Great. Thanks so much, Irene. And hello, colleagues. As Irene said, my name is Sunita. I am with the UNICEF East Asia Pacific Regional Office based in Bangkok, and really pleased to see many faces who have been joining us from the very beginning of this series, which, as Irene mentioned, most recently was in May, but in fact we kicked off this risk mitigation effort for the interagency GBViE group in December last year with the overview of GBV risk mitigation. And it was with that group that we really started to prioritize the topics of interest for the group and across the region that were relevant for the different kinds of emergencies that we are addressing, and included a variety of topics, including those that we'll cover today. But we started last quarter with a webinar that focused on understanding risks, so understanding GBV risks and that analysis, and then focusing on a specific tool, which was GBV safety audits. So within that, we really wanted to start looking at what are the different ways in which GBV risk mitigation strategies address issues and address these risks at individual level, at community level, and society level, recognizing that different tools and different approaches will target these in different ways. But of course, we know that that analysis overall is required across the 3 different levels. And so we were able to look a little bit at the purpose of those, identifying those key data points and understanding the relevance, and then diving into safety audits, which really focused more at an individual and community level, and the ways in which the use of safety audits to identify risks and identify whether our risk mitigation strategies are working is a tool for us. And so it's a really nice segue into the topics for today, which will continue to support us in understanding what are the tools and approaches available for us, but also the ways in which we can think about utilizing them across these different levels. So with that, I will hand over to Brenda.
Thank you very much. I'm Brenda Nanteza, working with the IOM Region Office as a protection and GBV specialist. I'll take you through the AAAQ framework. When we talk about availability, acceptability, accessibility, and quality, this is a tool. But before we go into details, we would like you to to scan and take this quiz and share with us what comes to your mind when you think about availability, accessibility, acceptability, quality framework in the context of barriers. Please tell us one word. You can type in one word after you log in. Kindly let us know if you have any challenges logging in. Just one word, what comes to your mind?
Irene, the slides went away. But for colleagues who weren't able to get the QR, the link is in the chat.
Sure,
so you can
we can see.
well.
We can see more responses coming in. Just one word. You may choose availability and talk about that. Or you may choose accessibility. You may choose quality. You may choose acceptability. Feel free to choose any. We can see so many words coming in. Yeah, just your own understanding. Yes. Sure. Yes. Keep posting. Keep posting. Oh. Okay. We have only 18. Let's all join 21. Yes, we're almost there. We're almost there. We are halfway there. We are halfway there. We can do it. Yes. Yes. Sure. Sure. Let's look at what we have. We'll select a few of the words that we have and look at it. Thanks to all colleagues who have participated. Yes, we are almost closing. We are closing the Slido so that we can just look at what we have. Yes. Okay, looking at the feedback that we have, let's have the results. Okay. Looking at the feedback we have, there are a number of responses that have been provided, and each and every response is contributing. But I would like to pick out the key things that we will be discussing further today. Physical accessibility, sure, this is something that we'll go into details to look at. And we have intersectionality. Yes, it cuts across. And when we are talking about barriers, when we are talking about the AAAQ, we have to think about intersectionality. Yes, we can see barriers. Yes, someone got it right. AAAQ framework, it's all about barriers. Then we have financial accessibility, correct. We have consultative, yes, for us to have the AAQ framework tool to use it, we need to do a lot of consultation with women, men, girls, and boys, persons living with disability, because I can see all the groups have been mentioned here. So most of the things that you've highlighted here are very relevant to our discussion today. And thank you very much for participating. Holistic approach, yes, accountability, reporting. Thank you so much. We are indeed grateful. Thank you for taking part in this Slido. We will just go into details to talk about the AAQ framework. Okay. When we talk about availability, accessibility, acceptability, and quality framework, this is a tool, and this tool was developed by UNICEF. And we know that interagency approach is the way to go. That's why all of us, we are utilizing this tool, and it has been very influential and very useful for our work. And it's a tool which we are using to identify potential barriers to accessing services in humanitarian setting. When we talk about this tool, it was originally developed for the health care sector. However, it can be utilized to assess other types of services like GBV services, and we've been utilizing it in different levels of interventions for us to identify the barriers, the potential barriers that are preventing community members or the people we serve from accessing the humanitarian services in the areas of operation. So as you look at this house, it's framed. These are services, and there are a lot of barriers that are blocking people from accessing services. And we would like to go through one by one to discuss some of these barriers. When we say AAQ, these are just concepts that we are utilizing to look at the different barriers. They are categorized in these 4 thematic areas. When we talk about availability, you find that in all the locations, we can go to the next slides, you find that in all the locations, before we move to further details about the 4 concepts on barriers, I would like to emphasize that when you talk about the barriers, we're looking at factors that are hindering the effectiveness and the efficient provision of services. And these may be perceived at different levels of intervention. It may be at availability, maybe quality of the services that are being provided. Are the services acceptable at the community level? Are they even accessible? For us to be able to understand this better, we will use examples to explain. You find that in most of the countries where we are operating, I'll use Afghanistan as a case study and Pakistan as a case study. You find that in Afghanistan and Pakistan, there are available services. And these services they are existing in different locations, in refugee context, in also the emergency context where we usually have flood. These services are available. Even in other locations, in other missions where we have disaster emergency response, we have these services available. But we don't only look at the existence of the services. What are these type of services that are there? And what are the qualities of these services? Who is providing the services? Are the staff trained? Are there supplies? Do we have both female and male service providers within the locations? If we look at Afghanistan, where we have the restriction of female staff working, this means that there are barriers in terms of accessing services. The females, women and girls, will not be able to access the services that are required to address their needs because there are no female service providers. though some may still access them, but this will hinder their access to services in the long run. If we look at physical acceptability, in locations of return and in locations where we have the refugees settlement, you find that most of the times the services may be located far away from the service provider, far away from the refugee settlement. And sometimes you find that these services are in places that are not accessible. If we look at the evacuation centers in the Pacific, some of these evacuation centers are not accessible to persons living with disability. So it means once they are within this evacuation center, they may not be able even to move out and access the services that are outside, or even to access that evacuation center during emergency for them to have access to the different services that are available. And most of the times, those who are in refugee settlement, the migrants, the returns, they are having challenges in accessing services because some of these services, there is need to incur transport fee for them to use these services or to access them. Maybe they are located far away from their services, or they don't have the, for example, in Pakistan, when we talk about administrative accessibility for the remote service provision, for example, GBV remote service provision, you find that the undocumented Afghanistan may not be able to have access to the mobile network. So it means they will not be able to access these services. And sometimes there are restrictions. There are implementation of the different policies that may block them from accessing the face-to-face services. So all these are barriers. All these are barriers. If we look at still Afghanistan, we have the restriction of women and girls moving to access services, and the way some of the services are designed, and also the restriction of the operational environment. For example, the psychosocial services, they can only be accessed at the health facilities. And if women are not able to access them, then this is really something that we need to look at. Access to information. Some of our methodologies or modalities that we are using for communicating to communities are not reaching the household levels. And we know that in some of the locations like Afghanistan, there is restriction of women and girls to socialize or to go out there to access services or get information about services. And it becomes worse in locations where we have control and preventive measures that are being implemented, these policies being implemented. So all these are barriers, and it's important for us to have the tools in place for us to identify what are the barriers. If we don't address these barriers, it means these are risks that may expose the different groups to gender-based violence and other protection concerns. It is our role and responsibility to identify these barriers. But how do we do it? Then acceptability. Sometimes these services are not culturally appropriate. How do we identify the barriers? We have to use the availability, accessibility, acceptability, and quality framework. How do we use it? We may either use it as a standalone tool or integrate it in other tools that exist, including the tools that we discussed in the last webinar, the safety audit tools, the GBV risk analysis tool, the gender analysis tool, the safety mapping tools, the survey tools that you are using, the needs assessment tools. We can integrate it in different tools. Let's move to the next slide. Yes. So you can integrate it in any of the tools, and you can be able to identify the barriers that that different groups of people are experiencing while accessing services. And at this particular point in time, I would like us to have a case study, just looking at WASH colleagues, how did they integrate it? How did they use the AAAQ framework tool when they were assessing the menstrual hygiene management needs for girls in schools? Over to you, Eva. Thank you.
Thank you so much, Brenda. I hope I'm audible. Yeah, I hope I'm audible now. Okay, perfect. Thank you so much, Brenda, Irene, and Sunita. My name is Eva Evangeline Manohar. I am on a shadowing mission to the regional office in UNICEF, East Asia Pacific. And I'm delighted to present on behalf of our Micronesia colleagues on how they identified barriers to for girls accessing menstrual hygiene management. Next slide, please. Yeah, next slide, please. So we'll take a short trip to Micronesia, which is in the Pacific, and we look at why the colleagues in Micronesia, they identified that there was high rates of absenteeism. A lot of girls did not go to school because, or especially during their menstruation time, because they did not feel safe, supported because of lack of menstrual hygiene facilities and in their school and in their community to carry it to school as well. And this came to light in and around 2017 when the first desk review was done of the situation and of the MHM in Micronesia, and it was found that there was no data on the whole access of adolescent girls to menstrual health and hygiene products. And there, because this came into the purview, they partnered with the Department of Health and Social Affairs and with the College of Micronesia to establish a baseline on MHM. And that report came back and said that over 28% of participating girls dropped out because they did not have access to menstrual products and proper wash facilities. That's 1 in 4 girls, more than 1 in 4 girls. And that was very serious enough. And it contributed to a lot of absenteeism and dropout. And so it became a very critical issue to take up and understand. With that, the UNICEF office in Micronesia, they partnered with the College of Micronesia, and through interns they sought to understand with a pre-survey on what is the girls' knowledge levels in terms of menstruation, the whole process, the biological process of it, as well as the social norms around it, their access to MHM materials, and in particular, they wanted to test about the familiarity of girls with the concept of reusable pads, because there was a proposal in place at that time to provide reusable pads as opposed to disposable pads. This is for 2 reasons. Number one, the supply of disposable pads was quite low, so the supply did not meet the demand, the demand of adolescent girls being able to access it. Both availability and access was an issue. So so it was proposed that switching to reusable pads was both eco-friendly, as well as they would have the ability to use the reusable pads for a longer period of time, giving the system kind of the ability to catch up to the demand of MHM products. So in this survey, there was the AAQ done. I would request Irene to go to the next slide, please. Yeah, okay, perfect. This is perfect. So in the AAQ, they looked at the acceptability, availability, accessibility, and quality of the menstrual and wash services. In terms of some of the key findings that came out while in discussion with the girls. And this survey was done in 3 high schools, private high schools, where it was identified that there was need, and it was potentially proposed as the places where the reusable pads would be distributed. These were conducted not only with the girls individually, but also with the teachers and the principals to be able to understand the community and the social pieces around which are so critical in the lives of girls. So some of the findings so one of the key findings is definitely the lack of menstrual products, which really talk to the imbalance between the supply and demand, which led to girls not being able to access menstrual products because of either because of the fact that it was not available nearby, or because the cost was too high, and which led to frequent absenteeism. The second part is even when pads were available, there were inadequate facilities at schools where which was clean and which had the necessary privacy to be able to change pads, especially in a clean manner with soap and water. So that was something that made it almost impossible for girls to be able to manage their menstruation with dignity and safety. This, of course, led to a lot of experiences during menstruation. And a lot of girls said that they faced physical discomfort, emotional stress, not to mention a lot of peer experiences saying that, and the unsolicited advice in terms of how to handle it, which bordered on bullying and stigma, is what the girls identified it as. And they also reported about how certain adult interactions were not helpful, primarily because the adults also did not have access to menstruation products. So that was a cascade of what they had experienced, and the girls did not feel particularly felt supported by the adult infrastructure which was there. This definitely was the key reason that they identified for they could not stop the menstruation, but they could definitely stop going to school. So it was this or that. So we could definitely understand from the girls' perspectives. And as I mentioned, the lack of knowledge was definitely a big reason. Awareness both among girls and both among their parents and the community and the school staff as well. The teachers and the principal and so on was critical to was a big barrier in terms of girls being able to access safe and dignified menstruation practices. Moving forward, some of the things that the UNICEF office, in collaboration with the donors, with the Rotary Club, did was that they distributed the they distributed the reusable sanitary pads, which was not locally sourced. The first tranche was not locally sourced. They procured it from the donor and then they distributed it. This was distributed along with the celebration of the Menstrual Hygiene Day in the Rotary Club of Pompeii and in the College of Micronesia. So this was both a distribution event as well as an awareness event, kind of tying in together. And the office in UNICEF also worked with schools to improve their restroom facilities and to equip them with soap and water, basics that was required. And as we remember, one of the key barriers was definitely education and awareness among the society at large. So there were targeted campaigns which are launched, especially in the local language, to create information around this, materials, handbooks, not only just in terms of accessing the products, but also in terms of managing the products in a healthy and a safe way. And the last thing which UNICEF did when they saw the uptake of the reusable products, not just in terms of quantity, but also the quality improvement in the MHM of girls, is that they partnered with the local agencies, MSMEs, to scale up the production of reusable sanitary pads. So again, over 1,000 sets were produced locally, and with the support from Rotary, who also fundraised along with UNICEF. and they distributed it to disadvantaged girls in other schools as well. So these are some of the targeted actions which are taken to overcome the barriers. And we'll look at what the outputs have been because of these actions. So, so one of the best practice, and I think it's absolutely amazing what they did, is definitely that they sought feedback after the program has been implemented, both the awareness and the capacity building and the distribution of it. And they understood from the girls what worked well and what could be done better. So almost all the girls, 99 plus of them, reported that they had better knowledge and they were able to use the pads in a much more effective manner, and they had access to it because this is a reusable pad which has a shelf life of around 2 years. We also saw that because of it, like I mentioned, there was sustainability and scale up. The funding, because there was such huge uptake, they were able to get more funding and locally source the pads as well, which kind of really talks to the market side of kind of driving up the demand and supply of MHM. And lastly, and I think this is just one of the best ways to ensure sustainable shifts, is definitely the behavioral change in adopting an eco-friendly method and a cost-effective method of MHM as well. Because if we were to measure how much the disposable pads would cost, even if they were available, that came to around $120 per girl for 2 years. And with by supplying them with reusable pads, or even if they were to procure it, the cost only came to around $14 per child for 2 years. So that's a cost decrease of like 90% almost. So this really speaks to both in terms of cost effectiveness and eco-friendly and we are not even looking at the cost which is required for disposal and management of the disposable pad as well. So this really speaks to how it's a future the barriers where when barriers were understood, it also ensured the system become more future ready as well. So this is just a short summary of the project, of the wonderful project which has been implemented by colleagues in Micronesia. And any faults in the presentation is absolutely mine. But just please feel free to kind of chime in and ask questions, and or Sunita can answer. If not, we will be sure to put you in touch with the Micronesia colleagues. Thank you so much, and I'll hand it over back to Sunita.
Great. Thank you so much, Eva, for taking us through that and a really comprehensive example of how we can apply the AAAQ framework to real programming. So we're going to shift gears now and move into more in-depth conversation around participation of women and girls and how we incorporate that both in the use of AAAQ, but also, as we talked about in previous webinars, with safety audits, with just understanding how we design programming and so on. Next slide, please. Great. So we're just going to ask you to put into the chat, when do you think that consultations with women and girls should be done? We know they can be done multiple times. Do you think they should be done before the project begins, during the project, or when the project is nearing completion? And I will add a D that's not on our slide. If you think it should be all of those, feel free to put that in. So go ahead and reply in the chat. Perfect. Okay, so we see a lot of definitely an A before the project begins at all stages, all three, ABC. So really looking at how we see that there's value across all of these different elements and all of these critical stages in our program design, program implementation, program monitoring, but that it's really something that should be an element that's woven into the way in which we're doing our programming. Great. Next slide, please. Great. So again, what are some of the modalities that you think that we can use for consultations? We have A, focus group discussions, B, desk review, B, key informant interviews, excuse me, C, desk review, D, community mapping exercises, E, community activities, or F, some other participatory methodologies that maybe we haven't captured here. I see there seems to be pretty significant consensus that we think it's across all of this and that all of these might be great options, all methods, and there are probably many more that we're not including here. This is not an exhaustive list, and I think there are lots of creative ways that we see that people across the region, across programming in general, in humanitarian contexts, are really being very creative and innovative in the way in which we're incorporating consultations. So let's dive in a little bit to what we're talking about. So for those of you who've been with us in the previous webinars, you'll remember that we've talked about these three key areas as some of the good practice foundation for GBV risk mitigation. The ethics, dignity, and safety, which is really our do no harm principle that we're all accountable for, that we have a survivor-centered approach, and that's really critical, and consultation. So here today, we're going to really dig into this consultation piece, and we're referring particularly to ensuring that we're engaging, seeking, incorporating inputs, information, and perspectives from women and girls themselves. Great. So we know that when and where women and girls are actively engaged in identifying their views, their perspectives, and their lived experience, that we're able to respond better, and that we know that the collective action is able to contribute much better to solutions, rather than me sitting behind my computer, deciding what I think the solution should be, and then implementing that. So I think this is something that we can all agree on. We've seen it regularly. It links very much with our AAP agendas, our PSEA agendas, as we'll hear from Pamela in a little bit. But really is how we think we should do business if we're being accountable to the populations that we're meant to serve. A tip sheet that we'll share the link for that helps provide a little bit of guidance on safe and meaningful consultations and participation of women and girls. With this, and the approach that we want to take is really in those consultations and through that participation to understand and address the barriers and risks that women and girls face, and to enable their participation in decision-making. So it's not just about the access to services. It is, absolutely. That's part of what we want to do. But we also want to make sure that women and girls are fundamentally at the center of how we're designing programming, how we're implementing programming, and that it's really about them at the center. And so building that in, as we're understanding the risks, we're thinking about how we address those barriers, we're really trying to ensure that they're at that center. And part of that, of course, is that we know that there is broad intersectionality around the experiences of women and girls. There's no one woman, there's no one girl for whom a program is designed. We know that there are various differences, characteristics, experiences that a woman or a girl may have. And we want to make sure that in that participation, if we're thinking about meaningful participation, that we're trying to reflect the perspectives of groups that are both marginalized, but also that are diverse. To do so, we want to look at existing entry points. So what are the ways in which we can leverage the existing entry points in programming with other sectors? So are there women and girls safe spaces through our GBV programming that we can already try to take advantage of as a way to organize and to have that coordinated space for some of these consultations? Similarly, if we want to look at engaging adolescent girls, are there youth and child-friendly spaces or education spaces that might be appropriate? We know often in nutrition programs, there may be mothers groups or opportunities where women are coming together, even if it's not organized yet, in nutrition programming because they happen to be the ones bringing their children for those nutrition programs, where we might be able to take advantage of that as an entry point. And then similarly, we know across all of our sectors, across all of our programs, there are a lot of community engagement opportunities. So we see very often, as we did during COVID, that one of the community engagement pieces that really remained was around hygiene promotion. And we had those house-to-house visits. We know that happens in many other ways as well. So with immunization campaigns, with back to school registration and so on, there are many ways in which we're able to have that community engagement, where we could think about integrating some of the ways in which we might be able to solicit and engage women and girls' participation and feedback. And another critical element is really thinking about the local women's organizations and networks that might exist, both formal and informal. And how can we engage with those and build upon the community linkages, the trust that they have, to see the ways in which they can also be voices for women, recognizing that they may have access in ways that we don't. And lastly, increasingly, we're using online platforms, digital solutions to seek feedback from communities. In UNICEF, as an example, we use UReport quite a lot. But there are numerous other ways. There's engagement through Facebook, there's engagement through polls, engagement in a variety of ways, SMS polls, and so on. So those are definitely avenues that we want to also consider and think about how we're incorporating, really thinking about the ways in which we can be diverse in the opportunities we're giving for women and girls to engage, but also being very cognizant, being very aware of the gender digital divide, and that we know that women and girls may not have the same access to these online platforms. They may not be able to participate safely. And so when we're offering and adding in these digital solutions and these digital opportunities, just to keep in mind that they may not be accessible to a diverse or marginalized group of women and girls. So those who are invisible now may be even more invisible if we rely solely on those digital platforms. So we really want to think about how we have a diverse way of that engagement. And I think, as you all highlighted already in that first question of when should we be doing this, we really see that the engagement, participation, and consultations with women and girls should happen throughout the program cycle. We know that it's critical when we're thinking about assessment and program design. They're able to themselves identify the risks in the environment, the barriers, to identify the priorities, and also to share perceptions of safety. My perception of safety is going to be different than somebody else's perception of safety. And so we want to make sure we're taking that into account as we're doing that and we're designing programs. Of course, we then go into resource mobilization, implementation, where we also see that it's critical. We want to make sure that as we're implementing, as we're thinking about the ways in which we're actually delivering services, that we've built in a way in which for women and girls to provide feedback on both their AAAQ perceptions, but also if we've taken measures, we've put in place mitigation strategies to address the risks we'd identified previously, to understand if those are actually working. So we can continue to have program adaptation that's responding to risks as they come up. In the best of circumstances, there's still going to be GBV risks. We know that those exist in everyday life, regardless of how perfect we think a program may be. And so this ongoing engagement to provide feedback, to think about how we might make program changes, and then to continue our implementation is really an important way of ensuring that we're being nimble and adaptable as situations change. And then again, as you all highlighted, the importance of women and girls in monitoring and evaluation is critical. They will help us identify what worked and what did not, and why. So maybe from a programmatic point of view, there might be some technical reasons why something didn't work the way it was supposed to. Building material wasn't delivered on time, and so there were delays in, doing a improvement on a school. But there might be other factors that are not the technical ones that we're aware of that might have impeded or affected program and service delivery. So we want to really understand that. We also want to make sure that those perceptions of safety and understanding whether the mitigation strategies and measures are working. And that's important both for future programming, because of course we know these are ongoing programs and there's rarely a start and stop, but that's really part of our process. But also it can help generate lessons learned and next steps. A lot of what we speak about in GBV risk mitigation today builds on the work that's happened over some years before, where things have been tried, there have been changes, and we've been able to continue to build and grow together as a community. So the work and that feedback from women and girls also is really critical for us to be able to inform and support others in the future, to be able to continue to improve the way in which we're delivering programming and services across all of our humanitarian sectors. Next slide, please, Irene. Great. So the last sort of theoretical piece that we wanted to highlight on this is just a little bit of a breakdown on what we mean by consultation. Because I think there is, if for those of you who are involved in, and I hope it's all of us, in considering how we're integrating gender and thinking about gender transformative programming, we know there's a very passive way of doing it. And then we know there's a way in which, when we're really getting to gender transformation, where women and girls are really driving the way in which we're programming. They're at the forefront of what we're thinking about and really pushing to ensure that their needs, their rights, their preferences are at the center of that. And we're really transforming the way in which we're thinking about our work. Similarly, with consultations, we have a spectrum. So there's a spectrum where, in a passive way, we're maybe engaging women and girls in the process. So perhaps we're having an information session where we say, this is the program, this is what it's going to be. So they're getting some information, but they're not able to actually contribute. So they're not able to make decisions about the program. They're not taking action. It's a very one-way passive engagement that we're having. And then we move into information transfer. So maybe we seek information and we ask, as we're designing a program, what are your needs? And we understand that there's a need for a school. Is that true? And so they're saying to us, yes, we definitely think that there's that need for a school, but then it's not going further in terms of making decisions or being part of those discussions to identify, what does that school look like? What are we able to design? Where's it located, etc. So we're getting some information, but it's still not really part of our decision-making. Then we move maybe into functional consultations. And I think in some ways, this is more common, I think, in terms of where we are in the humanitarian sector right now, where women and girls are guiding some decision-making, but it's not necessarily with real influence. So maybe we're doing consultations with partners and with women and girls, local women's organizations, and then we're going back to our offices and we're writing those proposals, and we're not having a back and forth. Say, is this really what we talked about? Does this really make sense? And so they are guiding our decision-making. We're getting that information and we're using it to decide how we want to proceed. So it's functional, it's helpful, it's useful, but we can go further. And these are these last two areas, which is really where we want to move towards. And we do, of course, have good examples of this also that we'll hear about. One is being more interactive. So we have women and girls who are actually involved in decision-making with other partners. They have a seat at the table, and it's not a seat at the table that's there to check the box, but a real seat at the table where they're equals in the participation, they're equals in the decision-making, and are really helping to drive that collectively. And then lastly, and this is really where we're striving to move towards, is ownership. So that women and girls control decision-making and that work with other partners to then implement actions. So it's not about us doing, but it's really about women and girls deciding and them leading on that. And that's really what we want to move towards. But I think, it is a spectrum. It does take time. And as we've talked about in previous webinars, there are skills and understanding that also need to be built. And I think, as I think was put into the chat, we do have some tips. There are some e-learning courses, I know, with UNICEF on our, but across other partners as well, on consultations and some of those skills and knowledge. So something definitely to continue to build. And as a great transition, I think, exactly in how we do that and how we're putting women and girls at the center of our programming, I'd like to invite colleagues from IOM. I'm hoping our colleague from Bangladesh, Pooja, is online and has connectivity. Yeah, okay, perfect. So
Yes,
Pooja,
can
I
you
will
hear
hand
me?
over to you.
Thank you very much. Thank you, Sunita. Yeah, it's a great opportunity for IOM Bangladesh and me particularly as a CCCM practitioner to present the case study of Women Participation Project. Let me first introduce myself. I'm Pooja, a site management coordinator working in IOM Bangladesh, coordinating the CCCM activities in the 17 camps. And I also have a colleague online, Bashir. I think he will give his introduction later on. Maybe we can go to the next slide. Okay, what is WPP, Women Participation Project, and why is it relevant in Rohingya response or in the camps? I think before I go to that, it's very important to understand the context of Rohingya crisis, which I'm sure you are aware of this. But again, Rohingya camps in Cox's Bazar is one of the world's largest camps, hosting nearly 1 million Rohingya Muslim minority population who arrived from Myanmar before and also during the influx in 2017. And the people are living in 33 camps, 17 are being managed by IOM, rest are by UNHCR. And these camps are overcrowded. They are mostly in the hilly areas. They lack adequate camp infrastructures and facilities, and they have increasing safety and security concerns over the period of time. And all the Rohingya population in the camps are dependent to humanitarian aid because there are not many livelihood options. And the interesting part is the camps have multiple disasters from monsoon rainfall to landslide, floods, cyclone, fire, which makes it very difficult for people to live in general. And if you see the demographics on the slide, so gender distribution is nearly equal with 51% female and 49% male. And like in any other displacement situation, women and girls face increased gender-based violence because of the lack of enough resources, safety and security concerns, and not having proper living condition. And camps of Cox's Bazar is also one of them because of its nature, as I explained earlier. And this is actually the origin of Women Participation Project, WPP, which came as a strategy which has a very holistic approach to reduce the risk. It's a global program designed in 2016 with WRC, and it has been implemented in many countries, and IOM Bangladesh is one of them. And if we were to talk about the objectives of the program, is to reduce the specific vulnerabilities of women and girls, provide them meaningful participation in camp activities, reduce GBV risk, and amplify the voices of women and girls. So maybe we can go a bit deeper on the program aspect. Yeah, the process and the structure that we have followed. So as WPP was started in 2016 in IOM Bangladesh, we started in one of the camps as a pilot project that was in Teknaf in coordination with the IOM Protection and GBV team, aiming to identify the key barriers that exist in the Rohingya camps for women to access the services, information, and be part of the camp governance. And the formation of the WPP was done with series of consultations with different tools used and the baseline assessment. Linking with the AAAQ framework, it was incorporated in the WPP program. The questions from the AAAQ tool were included into the baseline assessment and safety mapping tools. And these were used across the consultations. It's 4 there, but 24 consultations for establishing WPP, but not just to establish, but also to expand from the pilot project gradually to the 17 camps. And again, in terms of the tool, the availability, we checked with women if they are aware of the available facilities and humanitarian services that are provided in the camps, and if they are safe enough. And a safety mapping was also done among the women, where women identified the areas where they find risky and where there is a need for multi-sectoral interventions, including the installation of solar street lights or wash facilities. In terms of accessibility, it was also important for us to understand if women are able to access the services in easier way, at ease, and also to identify what are those physical and psychological barriers that are preventing the women to access the services, which could be on the distance because of the hilly part of the camps, or it could be overcrowding, and so on. In terms of acceptability, we checked with women. We get the feedback on the cultural appropriateness of the programs that has been provided. So this helped us to understand if the service providers are respectful of their dignity and cultural norms. And as a CCCM practitioner, I think quality is very important to have a minimum standard for all the sectors followed. So our consultation process included question on the quality of the available services. They were multi-sectoral assessments and particularly focusing on health, hygiene, and safety. So in overall, protection mainstreaming and inclusion was a key in our approach to capture the diverse needs and enhance our accountability. So definitely the target group of the project are women and girls, including those with disabilities. But we also included the community members in the consultation process, including family members, parents, community leaders, imams, and husband for the inclusivity of the program. In terms of training and ethical consideration, staff involved in the program and data collection process were trained on the relevant tools. The tools were translated in Bangla for easy understanding. There were ethical, social, and cultural considerations. And the staff and volunteers were also trained on how to handle the sensitive information, how to handle the disclosures appropriately. So different kind of tools were used, as you have explained earlier, the types, the consultations, FGDs, key interviews with the stakeholders, safety mapping, survey questionnaire for receiving the baseline information. And we identified the key barriers that prevents the women, which are mostly the cultural norms, which are traditional gender roles limiting to women's participation, safety concerns in the camps, lack of information, and lack of economic independence. As we identified the barriers, the program is also about addressing the barriers. So we needed to set up a structure. So an inclusive and participatory approach was taken to select the women committee members and leaders from different blocks of the camps. And those women who were voluntarily agreed to be the champions and reach other women in the community. And again, linking to what you said earlier, it's not just about receiving the information, but also to give back to what has been expressed. So we provided women committee members and leaders a lot of activities ranging from capacity building, skill development trainings, financial literacy, Cash for Work program, linking them in emergency and preparedness activities, engaging them in construction of the major facilities in the camps, installation of the solar street lights, being part of the awareness raising activities, and most importantly, is linking the women leaders in the camps with the GBV actors for the referrals to be done as they see GBV cases in the camps among the women group. So now we have around 1,900 women leaders across the camps, and you can see some of them in the pictures. So it's very great to see that women committee members are now included in camp coordination and sector meetings, which includes the camp stakeholders and government counterparts to express their needs and gaps that are in the camps, which is one of the significant output that we have seen. So WPP has played a vital role in terms of transforming some of the lives of women in Cox's Bazar camps, as an example for others. So this is the progress that we have made following the participative and consultative process in the last 5 years. And the challenges for us is to reach more women on a voluntary basis and resources and time, because I think for this kind of transformative program, we need to have a lot of time and patience. So with that, I would also like to request my colleague, Bashir, to give a quick comparison of what was there earlier in 2018 and what is the progress that we have made in 2023 as a comparison of our impact. Maybe the slide earlier, the third one, please. Thank you. Over to you, Bashir.
I'm just gonna come in. If you can come wrap it up in 1 minute, Bashir. Thank you so much. So we have 3 more people coming in. Thank you.
Okay, thank you. Quickly, for me, I'll just go through the impacts the project had from 2018 situation. If you look at the decision-making level, women heavily rely on male family members. And now in 2023, you can see there is significant increase in women involvement in decision-making. When you go to the safety and gender-based violence and awareness, in 2018, you see that women felt unsafe outside their homes. There was limited awareness about GBV, and this was the situation in 2018. When you look at the 2023 impact, the perception of safety has improved. And in our recent reports, it shows that 83% of women now feel safe during the day while engaging in community activities. Previously, going out, even they had some safety issues. 79% of participants also reported that men recognize responsibility in ending GBV, indicating a positive shift in the community attitudes. If you look at the economic empowerment, the 2018 situation shows that women had minimal opportunities. When you see 2023, the women facilitated engagements in income-generating activities. Over 29% of women now are contributing financially through their own means. This economic empowerment has enabled to take more significant roles within women. It has helped them to take more significant roles in the community. When you look at the education and the leadership in development, the access to education and leadership roles was limited. But when you see at 2023, women have now access to literacy trainings, and there is improved self-esteem, greater participation in community leadership. When you look at the social cultural aspect, the situation in 2018, traditional norms were restricting women to remain in their homesteads. But now what happens? There has been a noticeable shift in cultural attitudes when women increasingly participating in decision-making. They are able to go out. This change challenges the traditional gender norms, which was restricting women to their homes. Now, when you look at the networking and increased participation, you see that on skill development, women had limited opportunities in reaching out or socializing with others, leading to isolation and restricted social interaction that was risky for women, and idleness was a bit risky for them. But later on, 2023, as of the report, it has enhanced networking, enabling women to connect with others. They are able to learn from other women. You will see one woman able to pass one main skill to the rest, which is helping them all to gain economic independence. Next slide. The last slide talks about the
Stop you there, Bashir. I'm sorry.
Okay.
I'll stop you there, and I'll give for us to have more time for Q&A, and hopefully we'll be able to cover it as well. So I apologize. Okay, I'll move you over to Chris. Thank you so much.
Thank you so much, Irene. I hope you can hear me, colleagues. My name is Chris. I'm working with UNICEF Regional Office for South Asia. I'm the regional PSEA, GBV, and safeguarding specialist. So basically, I'll just summarize the do's and don'ts that always have to be at the back of our minds when we are planning and undertaking consultations with women and girls to mitigate the risks of GBV. So starting with the do's, the first important aspect that we always need to consider is to ensure that we secure the consent of the women and girls themselves before kickstarting the consultations. And let's also remember that even after the women and girls have given us the consent, they are also free, I mean, as individuals, in the process of the consultations, they are free to withdraw that consent, depending on some of the concerns that they might have. And it's also very important to build trust, to build rapport with the women and girls. We can ensure that we build trust and rapport by being transparent, yeah, about the purpose of the consultations. What do we want to achieve? I mean, by consulting them, and how do we intend to use their inputs? And it's also important to be mindful to ensure that we don't consult a homogeneous group of women and girls, but we need to ensure that diverse women from diverse socioeconomic backgrounds and status, age, have to be part of the consultations. And let's also ensure, I mean, as a standard, that consultations with women and girls can best be done by fellow women. So women who are trained should be the ones to facilitate the consultations with women and girls. And it's also important to ask the women and girls themselves, I mean, to provide their inputs regarding what could be the choice of the safe space where the consultations are going to take place. Yeah, and further to that, let's also remember to ensure that we
Hi,
keep the
Chris.
questions
Did
simple.
we
Yeah.
lose Chris?
Hello, Irene, can you hear me?
Hi, Chris.
Hi, Irene, can you hear me?
Yes, loud and clear. I need
Oh, sorry.
if you can wrap up in 2 minutes, Chris. I'm sorry.
Okay,
I'm
okay.
time for
Yes,
Q&A.
yes. Yeah. So in terms of the don'ts, yeah, let's not put so much pressure on the women and girls to start sharing personal stories. And when we are doing the consultations, it's not time to start collecting individual data of the GBV incidents. That's not the right time. Yeah. And let's also not ask specific questions that apply to specific individuals. And the other thing we need to avoid is to organize consultations specifically targeting a group of women and girls who are GBV survivors. Next slide. Yeah, so as just a way of summarizing, yeah, let's also remember, I mean, when it comes to do's, let's also remember to consult GBV specialists. Yeah, let's also remember to consult GBV specialists to determine the right questions that we are going to ask women and girls when undertaking consultations. Let me just stop here. Over to you, Irene.
Perfect. Thanks so much, Chris. Over to Pam, I think.
Okay, thank you so much. So good afternoon, good day, everyone. I'm Pamela Marie Godoy, the Regional Interagency PSEA Coordinator, covering both humanitarian and development contexts across Asia Pacific. So we all know that sexual exploitation and abuse is a form of gender-based violence that constitutes an abuse of power by aid workers, whether humanitarian or development, against the affected population or the communities that we are serving. So the AAAQ framework also helps us to identify and address barriers that may impede access to services, which, if not addressed, can increase the risk of sexual exploitation and abuse. Irene, next slide, please. So this is a Venn diagram that I created to exhibit the linkages of GBV risk mitigation with mitigating risk around sexual exploitation and abuse. So the risk of sexual exploitation and abuse in general can be mitigated through GBV risk mitigation across our programming cycle. Recognizing that on the right side, we need still the comprehensive operational human resources management measures to be able to prevent and respond to sexual exploitation and abuse. And then consulting women and girls is also a critical component of sexual exploitation and abuse, acknowledging that women and girls are what we call contextual safeguarding experts. So they know the situations, they know the settings, and they know the people that can put them at risk of sexual exploitation and abuse. And they also know the ways in which we can intervene early to prevent and reduce those possible risks. So we also use the AAQ framework to identify barriers. Training of personnel to safely receive disclosures of SEA is something that we all do as well. For SEA allegations, we all know that there is an additional layer of training when it comes to mandatory reporting requirements and the limits of confidentiality. Next slide, please. So with regard to NFI food distribution and linking it to information accessibility, for instance. So when women and girls are not fully aware of eligibility requirements, the size of rations, the aid workers may use misleading information to sexually exploit women and girls. They may do this by promising women and girls favors in the form of being in the beneficiary list, giving them priority in a long line, for instance, or promising them a larger ration when in fact that amount is what they are already entitled to receive. So some ways that we can minimize opportunities for sexual exploitation and abuse includes, of course, meaningful numbers of female volunteers and staff within distribution teams. And with regards to physical accessibility, the distance and the transportation related needs should also be considered by planning distribution points and timing in consultation with women and girls. In relation to WASH, we have seen that women can encounter sexual exploitation and abuse in relation to accessing water by personnel who offer to fetch water or transport water in exchange for sex, or stop them from fetching water unless they offer sex in exchange. So women and girls, we know, especially those with disabilities, they face additional barriers in accessing WASH facilities. So in last year, we did an updated safety audit tool to also assess accessibility requirements for women and girls with disabilities. And I will include that in the list of resources. And then quickly for education, this is something that we did when we updated the AAAQ framework specifically for education clusters. We included questions in relation to code of conduct, and I will also include that in the chat. So I'll stop there, Irene, so we have time for a question and answer.
Thanks so much, Pam. So I'll open the floor for question and answer. I think we have 2 questions online. I'll read them out from A. I'm sorry if I'm mispronouncing the names. So I have one question here. How can we ensure application of AAQ framework so that everyone can get access to services and facilities in safe and dignified way, especially in humanitarian emergency setting situation, for example, in Myanmar, because we have a lot of limitations, restrictions, such as time, resources, funding, technical, etc. Over to, I think, Brenda or Eva maybe, or even Sunita.
Sure, I can come in unless Brenda would like to. Yeah, I mean, indeed, I think there are a lot of limitations and restrictions in general. And Myanmar, of course, is a really complex environment where you're working in a constantly changing and fluid situation. I think one of the great things about AAAQ is that it can be incorporated into our ongoing work. So it doesn't need to be considered as something that's standalone. It doesn't need to be considered as something that takes extra time, but that we incorporate into the ways in which we're working. In some ways, it's a little bit of a mindset, and that when we're thinking about our program design, we're thinking about our implementation and monitoring, that we're incorporating some of these key questions and key considerations into our approaches. And so I think with a lot of risk mitigation, what we don't want to think about, or we don't want risk mitigation to become, is something as an add-on, but rather to say this is something that's integrated into the way that we do business, and that the AAAQ framework is a way in which we can think about how we're meeting our own sectoral obligations and goals. I often say with WASH colleagues, if you're meeting your own 5 core commitments, which we know that WASH has, you're doing GBV risk mitigation, because a core component of that as it relates to AAAQ and consultations is that those are core components because they are looking at safety, they are looking at equity, they are looking at participation. So really just to encourage you to think about the entry points that exist already in programming and to find ways that you can leverage those to incorporate some of these considerations.
Thanks, Sunita. I will connect these 2 questions together because they're almost similar. Are there any example tools specific for specific sector, such as WASH? And I think there's another one here for AAQ. Do we have an AAQ framework for nutritional programming to address gender-based violence?
I can quickly answer that. Yes, we do have. We can find the links, but if not, we can share the documents. And then specifically for education cluster, when we updated the AAQ framework last year, it was supposed to be aligned as well to the indicators that is found in the interagency network for education in emergencies. So just to be able to make sure that we're aligning with also the indicators that are being used by education in emergencies actors, so that it's part and parcel of the work that they do and not an add-on, as Sunita mentioned.
Thanks, Pam. And we'll send out the recording alongside with the slide deck and all the materials mentioned during our sessions today. There's one question here. What about promoting gender equality, integration, and gender mainstreaming in GBV programming to mitigate long-term GBV risk or evidence-based intervention to transform gender norms? Such a big question. All our eyes are like popping out.
Irene, I think the question may have gone directly to you, so I don't have it in front of me to read. But I think, you know, of course, we want to ensure that we're integrating gender and we're thinking about gender transformation in all of our programming, including our GBV programming. I think we should not be immune from thinking because we work on gender-based violence, we therefore are not also needing to think about whether we in fact are being gender transformative and are we mitigating GBV risks in our own GBV programming. So definitely, I think it's really important. We have, you know, across the GBV and emergencies field and sector, I think some really good examples of different kinds of programming that try to address some of these issues, particularly, I think, with adolescent girls, and trying to think about some of that work, as well as some work on primary prevention that's a little more nascent and a little bit newer, but something that's there. But I think it's a critical area, and maybe one to put a pin in to think about a further webinar that we dive into, because that's really much more on our specialized programming and maybe less on the risk mitigation side specifically.
Yeah, I have 2 more. So how to overcome social and gender norms to participate women and girls in decision-making process. And I have, okay, I'll stop there first. I think this was addressed during your presentation as well, Sunita, about engaging women and girls all the time.
Yeah, I mean, I think there are barriers. And I think even if we're committed to doing it, it is challenging. And there are those social norms, situational barriers and so on that exist that require us to be creative. And so I do think it's a commitment that we have to make to find those solutions, even when it seems like it's the more challenging option. Because of course it's easier to gather those who are right in front of us. And so I think we have to really do it with some dedication and focus. But Brenda, I also see you're on camera, so maybe I'll hand over to you.
Yeah, thank you very much. For sure, this has been a challenge, most especially for our CCM colleagues, not only in the Asia Pacific, but also in other regions, to ensure decision-making, most especially when it comes to governance structure at camp management level or in emergency setting. And a lot of work has to be done. But I think one key thing that we can also look at is in terms of looking at our GBV prevention, how we can support in terms of looking at issues of social and gender norms and power. So I think that is another alternative, and also doing a lot of engagement on community participation with the males within the community. So I think those are some of the ways on how we can support in terms of addressing some of these barriers. Yes, and maybe just to add a little bit in terms of the first question, there was a question on administrative barriers. So I think that also calls for the regional advocacy in terms of addressing some of these barriers or challenges that missions are experiencing in terms of facilitating access to services, and also having an enabling environment for operation or for delivering assistance. So it goes more of a regional approach on advocacy key messages, because as Sunita mentioned, it's not all about collecting information, but we can utilize this information to inform adjustment of program or to inform advocacy messages as part of the strategies. Thank you.
Thanks, Brenda. I'll keep you on because I think the key messages are yours as we close. If you want to close up with our key messages, and I'll close with some some reminders coming from our WG. Go ahead, Brenda.
Okay, thank you very much. As we all discuss, it's very key for us to have risk mitigation measures in place, different strategies, and these strategies not only apply for risks, but also apply for the barriers. And we say the AAQ framework is the tool for us to go and utilize, and we can integrate this into our other tools or use it as a standalone. And it's important for us to do a lot of consultations with women and girls at the interactive and also ensuring that they are engaged in decision making for us to have solutions that are going to work for all of us, and not only us as service providers, but also those that are receiving assistance. And when we talk about barriers may also refer to us who are providing assistance to community members, and also those who are receiving assistance. And we said it has to be integrated throughout the entire program cycle. Thank you very much.
Thanks, Brenda. Okay, I'll move ahead. So just to, before we wrap up, a reminder to everyone, we still have the third part of this risk mitigation series. It will be on monitoring and evaluation of GBV risk mitigation indicators. So I'll stop here. I just want to thank everyone, all colleagues, all experts who came in for this session today, this morning. It has been very, very fruitful discussion, and I hope this was a very helpful session for everyone, expanding our knowledge and appreciation of frameworks that we can use for risk mitigation. So thank you again for our co-hosts, UNICEF, UNFPA, IOM, and of course the Interagency PSEA Network for Asia Pacific. I'll stop here. I allow all my colleagues just to thank everyone. Thank you again, and hopefully we'll see you all. And thank you for all those who answered for the poll question. Stop here. I'll allow some of our experts to say goodbye.
Thank you, everyone.